to diabetes story and treatment. For a long time, dietary fat has been recognized a potentially essential modifiable risk agent for diabetes. However, nutritional medicinal therapy is a very essential section of the medicinal observation for the patient with diabetes. The diet demands to supply appropriate energy to accomplish allergical weight, as well as appropriate improvement and growth. Consuming fish, which contains high amounts of polyunsaturated fat, owns a beneficial impact on glycemia. Social cognitive theory puts a multifaceted causal framework in which self-efficacy opinions work together with aims, result expectations, and realized environmental facilitators and impediments in the arrangement of a human motivation, well-being, and behavior. Much of the obtainable literature in kind 2 diabetes mellitus estimates antidiabetic medicines as monotherapy or in connection with medicines other than metformin drug. Belief in one's efficiency to practice control is a popular path through which psychosocial impacts influence health functioning. Persistent administration of glucagon-like peptide 1 decreases blood glucose to near ordinary standards in both the postprandial and fasting state in human subjects with diabetes via forbidance of glucagon secretion and gastric emptying, and as well promoting of insulin secretion. Sulfonylureas induces the insulin liberation in a glucose-independent pattern, manufacturing them efficient anti-hyperglycemic factor and as well elevating the probability of hypoglycemia. In comparison, sitagliptin, the dimethyl 4 inhibitor, performs by studying the dimethyl 4 substrates, gastric inhibitory, polypeptide, and glucagon-like peptide 1. Together, incretin hormones which perform in a glucose-dependent way to elevate the insulin secretion via beta cells. Given their procedure of action, the most popular adverse impacts of sulfonylurea is the case of hypoglycemia. Cletazone elevates non-oxidative glucose elimination, elevate triglyceride synthesis, and develop metabolism of free fatty acid. Interestingly, the secretion of insulin was remarkably greater when nattiglinide medicine was taken per your meal matched to nattiglinide offered in reply to just the meal or in the fasted case. So, rabaglinide medicine links to the sulfonylurea binding positions on beta cells of pancreas and owns an identical procedure of action. Ribaglinide manifests distinguished pharmacological merits matched with these agents. Rosiglitazone and pioglitazone, which belong to thiazolidine group, are two oral blood glucose reducing medicines for the therapy of kind 2 diabetes mellitus, which have been merchandised in the Netherlands country since 2000. Alpha-glucosidase inhibitors can be utilized as an initial line medicine in recently diagnosed kind 2 diabetes, insufficiently cured with exercise and diet alone, as in gathering with insulin and whole oral antidiabetic agents if monotherapy with these medicines drops to accomplish the aims for postprandial blood glucose and HbA1c.